The role of more investor-driven for-profit healthcare is on the table again during this election. Claims have been made that, quote, as long as the needed service is publicly paid for and done safely, it shouldn't make a difference whether an operating room is run by a public hospital or a for-profit private surgical center, unquote. How does your party respond to this quote, and what evidence do you have that would support your position?
The Alberta Party responds by this way: if we believe in public health care. We believe in having a full audit immediately upon becoming part of the government to find out the transparency that has been missing. We don't know how to fix the problems if we don't know what the problems are, because half of it is kept from us. We believe that the recommendations have been clearly given and then they're being ignored. So either my fellow candidates haven't heard the recommendations offered in the Health Quality Council, or they're just ignoring them and going ahead and doing what they want to do. We would like to talk to everybody and make sure that Albertans are getting the health care that they want to receive, and that I believe that that's a public health care for all of us without regard for wealth.
I'll pick up on one of your comments, Corey. This is the most secretive government in our nation, the Alberta government. Just last week, the University of Toronto Law School released a report analyzing freedom of information across the country. Alberta had the lowest rating of access to information. We have a government that hides not only its mistakes, it hides where it's spending and hides where it makes decisions on who to contract for different services. We do need an audit. We calculate that we overspent by $1.2 billion in the transition between 9 health regions to a single super board. But to get to the question, do we support investor-driven healthcare? We do not. These become parasites. Insurance companies become parasites. If we have a parallel private system, doctors migrate from the public to the private system because there are many advantages in the private system, including more operating time, more income, less demands. They can cherry pick the kind of cases they allow into the private system. They can exclude some people who are too complicated and too costly for their particular service. This is not a recipe for, I'm done. I just got started.
Look, Alison Redford, our Premier and our party's leader, has been abundantly clear that she's committed to a public healthcare system run by the public. There's no room in an Alison Redford government and a progressive conservative agenda for private hospitals. It's that clear, it is that simple. We shall not go down that route. We know what party wants to do that. We won't allow it to happen in our Alberta.
In answer to the question, absolutely not. David and I were talking earlier where we met before. We met on the Friends of Medicare rally lines. The Alberta New Democrats, Friends of Medicare, Federations of Labor, seniors groups, we have been out there every time that this government has tried to bring in private health care. We will be out there again if they try and bring it in again. And Ms. Redford says she doesn't want to bring it in. However, the past Conservative governments have done the same thing. They have avoided the question during the election and then tried to bring it in afterwards. You know what? When we say no to our kids, no means no. When a woman says no to a man, no means no. This has been answered many times before. The people of Alberta say no means no.
Thank you. The Wild Rose is committed to a public health care system, and quite frankly, we wouldn't be having this discussion if the health care system was working as well as it should be. We are committed to the 8-hour benchmark. We are committed to building more long-term care nursing beds, not continuing care beds, not assisted living care beds. They're a hidden tax on seniors. And we're quite frankly committed to hiring more family physicians and getting more frontline workers into the front line where they should be. We've also put in our Alberta patient wait time guarantee. We've put out 10 wait times that have come from the Canadian Wait Time Alliance. And if those wait times aren't met, we will provide funding for someone to have the surgery done somewhere else. Thank you.